Okay, good day everybody. Welcome to our next episode of Dissection of the Human Brain. This time we're going to demonstrate the blood supply of the brain. We're going to do it in two parts. The first part will be the vertebro-basilar system, and the second part will be the intercarotid system, the so-called anterior circulation. My name is Dr. Sanjay Sanyal. I'm the professor and course director of neuroscience, and the camera person is Mr. Mark Lessard, our IT administrator. Okay, so let's first identify the vertebral components of the vertebro-basilar system. Here in front of you, you can see this is the left vertebral artery, this is the right vertebral artery. These are the intracranial parts of the vertebral artery. They enter the brain through the foramen magnum, and they unite at the lower level of the pons to form the basilar. So therefore, this whole thing is called the vertebro-basilar system. Now let's start with the vertebral artery. The vertebral artery is a branch of the first part of the subclavian artery. It has got a cervical part, it's got a vertebral part, it's got the suboccipital part. We are not bothered about those. Let's focus on the intracranial part. Once it enters the cranial cavity by piercing through the atlanto-occipital membrane and enters through the foramen magnum, it travels anteromedially in front of the medulla. This is the medulla. And it unites at the lower end of the pons. This is the pons to form the basilar artery. What are the branches of the vertebral artery inside the cranial cavity? It gives several spinal arteries, two posterior spinal arteries which are not visible here, and it gives two anterior spinal arteries which unite to form a single anterior spinal artery, which is also not visible here. But what is visible is this branch that we see here, this curved artery that we see here going and supplying the posterior and inferior part of the medulla. This is a very important branch, and this is called the PICA. This is the PICA on the right side. This is the PICA on the left side. It is the posterior inferior cerebellar artery. This supplies the lateral part of the medulla as well as the posterior and inferior part of the cerebellum. This is a very important branch, and I'm going to come back to this branch when I come back to the clinical correlations of this branch. Now let's come to the basilar artery itself. The basilar artery is formed at the lower end of the pons by the union of the two vertebral arteries. It runs on the anterior surface of the pons and a shallow groove on the pons which is called the basilar groove. And in this location, it is situated between the pons and the clivus of the occipital bone in a CSF-filled space called the pontine cistern. As it runs from below up, it gives off several branches, some of which are visible here. Straight away, we can see one branch here. This is the anterior inferior cerebellar artery. This artery is also another important artery. It supplies the lateral part of the pons, and it also supplies the antero-inferior part of the cerebellum. This also has got some important clinical correlations, which I shall mention later. If we trace the course of the basilar artery, we see multiple small branches are being given out, which are penetrating the pons all along the sides. Especially, we can see them on this side. These are known as the paramedian pontine perforating branches. They are also important branches because they are responsible for certain strokes, which we shall mention later. Let's continue with the basilar artery. As we progress up, we find that it gives rise to yet one more important branch, and we can see it here. On the left side, this is the branch, and on the right side, this is the branch. These are actually, sometimes it can be single, it can be double. These are the superior cerebellar artery. This is also a very important artery, and it supplies the rostral part or the lateral part of the pons. And as it winds around the cerebral peduncle, it also supplies the superior surface of the cerebellum, which we can see here. It is going to the superior aspect of the cerebellum here. So this is the superior cerebellar artery. I'm going to mention some important clinical correlations of this artery also as we go along. So this is the superior cerebellar artery on this side, and this is the superior cerebellar artery on this side going to the other side. And finally, the basilar artery divides into its two terminal divisions at the upper limit of the pons, and we can see this is one final division and this is the other final division. These two are the terminal divisions, and they are the posterior cerebral arteries. The posterior cerebral arteries, they wind around this structure here that we see. This structure is called the cerebral peduncle. They wind around the cerebral peduncle, and these posterior cerebral arteries, they supply, among many other structures, they supply the midbrain, and they also supply the occipital medial part of the temporal and the inferior lobe of the temporal lobe of the brain, inferior gyrus of the temporal lobe of the brain. So these are the bare bone branches. Now let's come to a little more specifics. So let's again start from the vertebral artery, the most important branch which we showed here, that is the PICA, the posterior inferior cerebellar artery. Occlusion of this artery produces a stroke syndrome of the brainstem, which is known as the Wallenberg syndrome. It is also called the lateral medullary syndrome. So therefore, this is an important artery from the point of view of strokes. Another important point, when the two vertebral arteries unite here, at this point, this is a very common site of atherosclerosis because of turbulence of the blood here. Next point, this AICA that I mentioned a little while back, this can also get occluded and it will produce another type of stroke which is known as the lateral pontine syndrome. Then these small branches that we mentioned a little while back, these penetrating pontine, paramedian pontine branches, they can get occluded or they can form small microaneurysms and they can produce small hemorrhages. Then they produce small lacunar infarcts of the pons. If they get occluded, they produce lacunar infarcts, and if they form microaneurysms, these microaneurysms are known as Charcot-Boucher aneurysms, which can rupture and they can produce hemorrhagic infarcts. Lacunar infarcts are by definition those infarcts which are less than 1 centimeter in diameter, and then they tend to occur among many other areas. They can occur in the gray matter of the pons. Now let's come to this major second last branch of the basilar artery which I mentioned a little while back, the SCA, the superior cerebellar artery. Now this also has got several important clinical correlations. First of all, you notice that it is running very close to the CN5, cranial nerve, trigeminal nerve. Sometimes a redundant branch of this superior cerebellar artery can compress on the sensory division of the trigeminal nerve and can produce trigeminal neuralgia. Next important point about this artery is, because it supplies the superior surface of the cerebellum, this occlusion of this also produces two syndromes. One, it can produce lateral pontine superior syndrome, and it can also produce pure cerebellar manifestations. This is more likely to produce pure cerebellar manifestations if it gets occluded. Another important point to be noted is that between the superior cerebellar artery and the PCA, we have the CN3, the cranial nerve 3, which is running between them. Therefore, if there's any aneurysm of any one of these, they can compress on CN3 and they can produce cranial nerve paralysis, ophthalmoplegia. Finally, let's come to the terminal division of the basilar artery, that is the PCA, the posterior cerebral artery. As the posterior cerebral artery is winding around the cerebral peduncle, this is also another very common site of atherosclerosis. And where the basilar artery bifurcates into the two PCAs, this is also a site of atherosclerosis as well as berry aneurysms. This posterior cerebral artery, it is considered as the artery of the midbrain, and therefore occlusion of the posterior cerebral artery can produce two important known syndromes. One is called the medial midbrain syndrome or the Weber syndrome, and occlusion of the paramedian branches of this PCA can produce another syndrome pertaining to the midbrain, and that is known as paramedian midbrain syndrome or Weber syndrome, Benedict syndrome. And finally, if there are further occlusions of the PCA when it supplies the occipital lobe, it can produce a whole host of syndromes, including homonymous hemianopia, alexia without agraphia, bilateral parotoccipital occlusion will produce balance syndrome, it can produce Anton-Babinski syndrome, it can produce blind sight. So, and it can also produce memory loss by virtue of its lack of blood supply, loss of blood supply to the hippocampus. So these are the branches of the posterior circulation or the so-called vertebrobasilar circulation. Stay tuned to this video. We are going to continue with the rest of the video, the anterior circulation, just after this. If any of you have any comments or questions, put them in the comment section below. Have a nice day.